Can my husband survive ARDS in ICU on 100% oxygen, PEEP 16, oxygen saturation 87 to 88%? My name is Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care, making sure your loved one always gets best care and treatment. Now, before I get started, if you're new to my channel and you haven't watched any of my videos yet, make sure you hit the subscribe button. Also, make sure you hit the like button, the notification bell, and more importantly, share it with anyone that has a family member in intensive care or can benefit from this video. Because my videos save lives for patients in intensive care, as is documented on our testimonial section and on our intensivecarehotline.com podcast section. And if you haven't downloaded any of our free guides on our website at intensivecarehotline.com, go there and download the free guide. So Esther, one of our clients, has a question today who says, "Hi, Patrick. Update on my husband who has ARDS and has been in ICU for 4 weeks. This is the second time the doctor is calling me to come and see my husband as he may not pass the night. His ventilator settings is 100% oxygen right now, PEEP 16, blood pressure 102/61. Though fluctuating and he's on blood pressure medications, the concern is his oxygen saturation, which is 87 to 88%. They said with the saturation as low as this, he may not survive. Please, has any survivor been in this situation?" From Esther. So, Esther, thank you for your question, and I'm very sorry you're going through this incredibly stressful and frightening situation with your husband in ICU with ARDS. Yes, absolutely. Survivors have absolutely been in this situation and have made full recoveries. 70 to 90% of intensive care patients actually survive. So don't let the doom and gloom, repel you from not giving up. The oxygen saturation of 87 to 88% is concerning, but it doesn't mean your husband can't survive. What's critical right now is getting access to all of his medical records so you can fully understand what's happening and what options are available. So let's first of all understand the current situation. Your husband is on maximum ventilator support right now, 100% of oxygen and PEEP of 16. The fact that his blood pressure is fluctuating and he needs blood pressure support medications shows his body is under significant stress. The low oxygen saturation of 87 to 88% indicates severe ARDS, but this is not automatically a death sentence. What concerns me the most is that the ICU team has called you twice now saying he may not survive the night. While I understand they need to prepare you for the worst case scenario, it's crucial that you understand all available treatment options before making any decisions. Treatment options that may not have been discussed. There are several advanced treatment options for severe ARDS that you should ask the ICU team about immediately. Number 1, prone position. Have they proned him? Put him on his tummy, head down, to see whether they can open up some collapsed lung compartments of his lungs and also drain secretions just via gravity. That's a standard treatment in ICU for severe forms of ARDS. Number 2, VV ECMO, venous ECMO. This is a life support system that can take over the work of your husband's lungs temporarily, giving them time to heal. VV ECMO bypasses the lungs and oxygenates the blood outside the body. Many patients with severe ARDS who wouldn't survive on the ventilator alone have survived and fully recovered with VV ECMO. You need to ask the ICU team, is my husband a candidate for VV ECMO? Do you have ECMO capabilities at your ICU? If not, can he be transferred to an ECMO center? Number 2, inhaled nitric oxide. Nitric oxide is a gas that can be delivered through the ventilator to help improve oxygenation by dilating blood vessels in the lungs. This can improve oxygen saturation in patients with severe ARDS. Ask the team, have you considered inhaled nitric oxide to improve his oxygenation? Next, inhaled epoprostenol, also known as Flolan. Similar to nitric oxide, epoprostenol can be nebulized and inhaled to improve oxygenation in ARDS patients by improving blood flow to ventilated areas of the lungs. Ask the team, can we try inhaled epoprostenol to help with his oxygen levels? And now the importance of access to all medical records. Once again, Esther, you need immediate access to all of your husband's medical records. This includes daily progress notes, ventilator settings over time, lab results and trends, which includes arterial blood gases, chest X-ray and CT scans, MRI scans, medication lists, ICU flow charts, and the list goes on. Leave no stone unturned. Having these records will allow you to see the complete picture of this condition, identify any mistreatment opportunities, get a second opinion from specialists like ourselves. We can look at the medical records and help you and interpret them, the information for you, and look at options and make fully informed decisions, because you're not making fully informed decisions at the moment. Now, request those medical records immediately. You have a legal right to them, not a privilege. It's a right. Don't let anyone tell you that you have to wait for them or that you can only get them after discharge and so forth. It's all nonsense. We never had a client that can't get access to the medical records, especially if you get help from us. We know how to help you get access to medical records. So why a consulting call with me or the intensivecarehotline.com team will help? A consulting call with myself or one of our team members, together with your husband's ICU team, can be absolutely critical right now. Here's why. We help question the current treatment plan and explore all available options. Advocate for advanced therapies like VV ECMO, nitric oxide, epoprostenol, prone position. Clarify the actual prognosis based on all available data. Challenge assumptions and push for aggressive treatment if appropriate. Coordinate a transfer to an ECMO center if needed. Ensure you're getting complete and accurate information. Many families have been told their loved one won't survive the night, only to find out there were treatment options that hadn't been tried or you didn't know about because you didn't speak to us, or facilities that could provide higher levels of care. We can be in the room with you virtually or by the phone during family meetings to ask the hard questions that you didn't even know existed, but must be asked, and advocate for your husband. Also, as a bonus tip, VV ECMO could also be a bridge to a lung transplant in case your husband's lungs don't recover. I bet you didn't know that. Looking ahead, intensive care at home. If your husband does survive this acute crisis and ends up needing prolonged ventilator support with a tracheostomy, you should also know about intensivecareathome.com. This program allows patients who need long-term ventilation support to receive that care at home rather than remaining in ICU indefinitely. Many patients who need tracheostomies and extended ventilator weaning can be cared for at home with the right levels of support. Intensive care at home can keep your husband out of ICU predictably and permanently, provide one-on-one CCRN nursing care in your home, give him a better quality of life during recovery, reduce the risk of hospital-acquired infections, allows family involvement in his care, and it often leads to better outcomes than prolonged ICU stays. And again, as a bonus tip, it cuts the cost of an ICU bed by 50%. This is something to keep in mind as you plan for different scenarios in his recovery journey. So, what to do right now? Request all medical records immediately. Don't wait. Ask about prone position. Ask about VV ECMO. Is he a candidate? Can he be transferred? Ask about inhaled nitric oxide and epoprostenol. Have these been tried and considered? Schedule a consulting call with me at intensivecarehotline.com and we join your next family meeting. Ask for a second opinion from another pulmonary critical care specialist or ECMO team. Don't accept there's nothing more that we can do without exhausting every option. The bottom line, Esther, is while your husband's situation is critical, I've seen patients in similar or worse situations survive and recover. Oxygen saturations of 87 to 88% is low, but with the right interventions, particularly VV ECMO, if he's a candidate, survival is absolutely possible. Do not give up hope, but do act quickly to explore every available treatment options. Time is critical in ARDS, and advanced therapies like ECMO work best when implemented before the patient deteriorates further. Get the medical records and schedule a call with us at intensivecarehotline.com and push the ICU team to consider every possible intervention. And we're here to help you advocate for your husband and navigate this crisis every step of the way. And remember, intensive care at home might be an option down the line. If you found this video helpful, please hit the like button, subscribe to my YouTube channel, and share this video with anyone who has a loved one in intensive care. Your support helps to reach more families who desperately need this information, and don't forget to download your free guides on our website at intensivecarehotline.com. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.